Hello, welcome to the channel. My name is King and I'm the CEO of A-Relief. On today's topic, we'll be talking about the difference between rheumatoid arthritis and osteoarthritis. Stay tuned. Now, knowing the difference between rheumatoid and arthritis is very important and very crucial. So we could actually know because they have different causes, they have different symptoms, and they have different treatments. And knowing the difference helps us to properly manage them. So that's the reason for this. Now, what's rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease where the immune system attacks the joint lining. So you have the immune system seeing the joint as a foreign body, which can occur sometimes, right? And it affects the joint, which causes swelling of the joint, which causes painful joint and stiffness. Now, those are part of the symptoms of rheumatoid arthritis. Now, rheumatoid arthritis also stands as a chance of also affecting certain organs of the body, like the heart and the lungs. Now, as we've said earlier on, what are the symptoms of rheumatoid arthritis? So we have joint swelling, we have joint stiffness, we have fatigue, and the stiffness especially during morning period. Now, what are the risk factors? What are the people that stand at risk of actually getting rheumatoid arthritis? For instance, family history. So people who actually have family history of actually having rheumatoid arthritis, they stand as a chance as they have the risk of actually getting it also, right? Then also gender. So rheumatoid arthritis is most common in women. That's another risk. Then obesity is also a risk. Obesity is also part of the reason why people stand at the risk of actually having rheumatoid arthritis, and also smoking. Now, treatment for rheumatoid arthritis. One, you get anti-inflammatory drugs from your doctors. You go to your doctors and then they give you anti-inflammatory drugs that helps with it. Then physical therapy, right? And also massage. So actually help that immune system make the blood vessels flow properly, and also help heal the joints and makes it better and stop the real pains and swelling. Now, osteoarthritis. What's osteoarthritis? Osteoarthritis, also known as OA, right, is caused by the wear and tear of the joint ligament during overtime, while used overtime. So while we tend to grow older, our joints, sometimes the cartilage around them that helps for smooth movement of the joints tend to get damaged. They tend to get weakened. They tend to get torn off. So that's what leads to osteoarthritis, when the cartilages are actually torn off, and now you have the joints touching and grinding each other, right, which causes severe pains, right? Now, the symptoms of osteoarthritis, right? So we have severe pains in the joints, severe pains, right? And then we also have stiffness in the joints, especially during and after activities. So after engaging in vigorous activities, right, that you've used the joint, it sometimes leads to stiffness and also pains. Those are part of the symptoms of OA. Now, risk factors for OA, we have age. So for people over 50 and above, right, they stand at higher risk of actually having osteoarthritis, right? We have obese people, right? So, and also joint injuries. So when people engage in joint injuries, and even after being treated, if it's not totally healed, right, they also tend to stand the risk of actually having osteoarthritis. So the treatment for osteoarthritis, right? We have physical therapy. Also, one, we also have pain relief. Having taken pain relief medication, it also helps for treatment of osteoarthritis too. Then we also have weight management. So for obese people, one of the ways of actually helping getting rid of osteoarthritis is by them trying to lose weight. When you don't have much pressures on those joints, right, the risks and the pains tends to reduce. The risks of having OA tends to reduce, and it also actually helps heal the pain. Now, just to buttress on the point, right, OA tends to affect joints that are that carry most of the weight bodies. So we have our hip joints and we also have the knee joints. Those are the joints that tend to stand at risk of actually losing their cartilages fast and having osteoarthritis. Okay, so key difference between rheumatoid arthritis and osteoarthritis. Now, rheumatoid arthritis is caused by the autoimmune system affecting the joints, so the autoimmune system, while osteoarthritis is caused by the wear and tear degenerative system of the cartilage during over time. Now, onset rheumatoid arthritis can start anywhere within the age of 30 to 60, while osteoarthritis typically starts from people above the age of 50. Now, affected joints. Rheumatoid arthritis tend to be symmetrical in effect, which means it affects both joints. So if rheumatoid arthritis affecting the hands, for instance, it tends to affect both hands. If it's affecting the knee, it tends to affect both knees, right? While osteoarthritis is asymmetrical, so it can affect only the hands and not affect the second hand. It can affect only one knee and not affect the second knee. Progressive. Rheumatoid arthritis tends to get more damage rapid over time without treatment, while osteoarthritis tends to gradually get damaged over time. Now, morning stiffness. With rheumatoid arthritis, the morning stiffness tends to last over more than 30 minutes, while osteoarthritis tends to stay within, give or take, less than 30 minutes, right? And then lastly, we have the systemic symptoms. With rheumatoid arthritis, you tend to feel the systemic symptoms. Yeah, while with osteoarthritis, you don't feel the systemic symptoms. So that wraps up all the differences between the rheumatoid arthritis and osteoarthritis you need to know. Now, also remembering one important way of actually treating this arthritis is through getting massage, right? In those joints, having massages in those joints to help relieve the pain and most likely even get rid of it without the intake of drug. So that's where A Relief come in. On our website, we have the vibrate massagers. We have different massagers that you could actually use, right, for heat massager to help on those joints, to wear on those joints, which actually helps breaks down the cartilages, civic crystal units in the joints. That also actually helps also reduce the swelling, the inflammations in the joints, and also help make the blood circulation flow properly, which reduces the friction of the joints from osteoarthritis. So click the link below, check the website, and also click the link below, check the website, and order a massager for yourself to actually help alleviate your arthritis pain. And also, you can also click the link below to join our Facebook group, where we share important information every day about arthritis, so you can get more updated every now and then. And you can also easily ask your questions and get responded to in the group. And also, comments below. We would actually like your opinion, and if you have anything you want us to treat on this channel, have any question, also ask in the comment below. We would respond to you as quickly as we can. Thank you and stay safe.